Most proud of ending up in a community like Detroit. I think, there's so many options in the suburbs, and I could have gone back to Canada. That's where I'm originally from. But I think this is where I'm needed most, and it just feels right. So I'm very proud that all my hard work kind of culminated to me working in this community. I am a full scope family physician here at the Rosa Parks Clinic. We're located right next to Detroit Receiving. I see patients of all ages, 0 to 99 plus, and I practice almost all aspects of family medicine. When you walk into my office, you'll notice that it's very warm and welcoming. I'm pretty laid back, I'm pretty relaxed, but that doesn't mean that I'm not, super thorough. I think if you ask the patient of mine, they would say that I'm very detailed in everything that I do. I'm a stickler when it comes to, getting your annual screening. So even if it's not, my patient's annual checkup, every visit I run through that list and I make sure, are you getting your mammograms? Are you getting your colonoscopies? But I do make it a point to just joke around, make sure the patient feels comfortable with me. And the first few visits, I'm just going to be getting to know my patient on a personal level. What sets us apart is that we have 3 registered nurses, which is not typical. For me, they're a great resource. I can rely on them. They know the patients inside out, and they go, that extra step with my patients. We also have pharmacists on site, which is great. Great resource for me. We also have a social worker in the office itself. We also have 3 specialists. So we have GI, cardiology, and nephrology. So I can easily just, go to them and I get a response in real time. And then I can also refer my patients to these specialists, and it just makes everything a lot easier. So if I'm reading an EKG and I'm concerned about this patient, while that patient's in the office, I can run over to the cardiologist and have them review the EKG. We can make a critical decision together. You can have all these resources, you can have great staff, but if you don't have that one-on-one connection with your patient and they don't feel comfortable around you, they're not going to be honest with you. I feel like that takes away from everything else. My approach, being very individualized, not everybody's cookie cutter. I follow the guidelines, but no patient is the same. So I think to me, that's the most important.